Hey,
Hi, Lily.
should you be eating that sugary yogurt with your diabetes?
Yeah, my doctor actually prescribed me this new diabetic medicine. It's called Lispro.
Oh,
It is my short-acting insulin.
how does it work?
Well, I'm glad you asked. So it lowers my blood glucose by stimulating glucose uptake in my skeletal muscles and fat. It also inhibits hepatic glucose production. And other mechanisms, it can inhibit lipolysis in proteolysis, and it also enhances protein synthesis.
Oh, so it's basically just giving you insulin so that your cells can access glucose.
Yeah, exactly.
Oh, and is it only for people with type 1 diabetes like you?
Actually, it's indicated for type 1 like me or type 2.
Oh, okay. And who can't take Insulin Lispro?
Well, it is contraindicated in hypoglycemia or if you have an allergy to or hypersensitivity to this medication. So it's important when you're first starting to work closely with your doctor to monitor your glucose levels and any adverse side effects.
And along those lines, how much do you take and how is that decided?
Well, it's actually all dependent on my blood glucose levels as well as my weight. So before I ate this, I actually took my blood glucose and I took Lispro that was appropriate. I also monitor my weight periodically during my therapy.
So this does require a lot of steps in it, taking it, a lot of contact with your provider. Was there anything else that your nurse or doctor taught you about this drug before taking it?
So
You wrote it down. That's
I did
so
write it down
smart.
because I thought it's good to keep it fresh. So I just know I have to figure out what signs of hypoglycemia look like in me. So personally, I've noticed it's anxiety or restlessness, but for some people it could be tingling in the hands and feet, in the lips and tongue, chills, cold sweats, confusion, cool pale skin, or drowsiness. So it's important just to tell your doctor about any of these side effects and so you can know when to take the medication safely.
Interesting. And body weight's important too, right?
Yes, it is. So I do need to be careful about if I do gain weight to tell my doctor so we can adjust the dose appropriately.
Oh. Well, thanks so much for telling me about this. Now I feel a lot more comfortable with you eating that new stuff.
Oh, thank you for checking.
High alert drug with a half-life of approximately 1 hour and is a pregnancy category B.
Adverse reactions of Lispro include anaphylaxis and hypoglycemia. Hypoglycemia symptoms include shaking, sweating, dizziness, and headache.
Alex and Lily are our actresses, Jordan with side effects, Brianna with more information, and Sarah recording.